Um, the next question asks, how can we shift therapist training from a pathology diagnosis oriented model to a more helping patients solve problems in life orientation?
I think it's happening. I mean, the positive psychology contributions to this, they focus on strengths-based practice and strengths-based approaches. Uh, we ought to be training at that level as well. Um, and maybe more of a growth model than a fixing problems kind of model. But I think it is already happening.
I do too, and when I look at, for example, your work, Bill, in terms of motivational interviewing, they're providing an alternate framework that can replace. So I would hate to say that the diagnostic framework, we just need to get rid of that. I've watched many very effective clinicians who approach their work in that fashion. To me, it's a little bit of window dressing, whether it's strictly problem focused or strength based, or this is kind of window dressing. How do we make that shift? I think we need to embrace our research literature and stop looking to psychiatry and medicine as if they have the answer. Not that we're not complementary, but right now it's hierarchical still. So I think that we need to embrace our literature. There's plenty of evidence that this relationship we provide is an amazing healing experience for clients. There's tons of evidence. So
Carl Rogers was a real skeptic about assessment and diagnosis. And I guess I fall somewhere in between, because at least if you're a highly trained professional, you need to know when you're seeing a recognizable syndrome of things, when you're seeing narcolepsy or when you're seeing bipolar disorder or whatever it is. That's not necessarily a starting point, but you need to have the background as the backup professional in the clinic, at least, to know what you're looking at and when there's something that really needs to be addressed as a diagnosis. But I don't see that as a good general model for how to be helpful to people. It's another skill that you need.
Well, and just to add to that, and I think to amplify what you're saying, Bill, it just can't help but remember the lady that called me up, and the question she asked was, do you treat bipolar disorder? And at first I said, sure. And about a minute later, I went back and said, you know what? I want to tell you something. It's not that I treat bipolar disorder. I treat people.
Yes.
If you happen to have a bipolar disorder, that's okay. And there was just this quiet sobbing on the other end of the phone to be recognized as a person, not as a diagnosis or a disorder.
Beautiful.
Yeah.
Can I just say one more thing, and Bill, feel free to comment here. I think the medical model as a paradigm is very intoxicating. And the intoxication is, if you do it this way, then you're absolved of responsibility if it doesn't work. And that's a deep problem. And much of the behavior that I would say you earlier labeled as superstitious comes out of that thinking, that if we just do it in this specific way, these particular techniques, then it all works out. There is an alternate literature. It's massive about what matters in psychotherapy. Your book is about it. That's what my book is about, the Better Results book. It's often that we don't know it, or we don't feel like it's sufficient in some way. It's not as good as.